Good afternoon. My story is entitled An Abundance of Caution, and that will become self-explanatory. 4 short words that changed the course of my life. My story begins in October 2024, following attendance at my GP practice for dull intermittent cramps I had been experiencing in my lower abdomen. The practice ran some blood tests. Some days later, the practice rang to advise that one of my blood tests relating to my liver function was slightly higher than normal. I laughed and said we'd recently returned from a 3-week road trip in Japan where I'd probably drank too much sake. No alarm bells rang. The liver test was repeated in 6 weeks to see if it had reduced. Some days later, the practice rang again and asked me to attend surgery in person to discuss my test result with a nurse practitioner. Still no alarm bells rang. On this occasion, I was blessed to be seen by Cheryl, an advanced nurse practitioner who was somewhat puzzled by the outrider liver test result in an otherwise fit and healthy patient. Cheryl then took a route I wonder if all GPs would necessarily have done at that time and referred me for an ultrasound test out of an abundance of caution. Still no alarm bells rang. The ultrasound showed I had a small blockage to the liver, but not why. Gallstones were proffered as a possible cause and an MRI scan recommended. Still no alarm bells rang. The GP's call post-MRI scan came whilst we were out shopping for last-minute items for a 3-month stay abroad. My GP sounded concerned and asked me to come into the practice that afternoon to discuss my results. I was confused, told him we were out shopping, and asked if we could discuss the results over the phone under the circumstances. My GP inquired when we were returning from abroad. I informed him we wouldn't be back until Christmas. My GP then repeated his request for us to come into the practice that afternoon. This time, the alarm bells couldn't have been louder. And I clearly remember saying, "Well, it's not cancer, is it?" To which he solemnly replied, "It could be." From that moment on, life as I knew it would never be the same again. Despite his earlier misgivings about discussing the matter over the phone, my GP proceeded to calmly advise me that the liver blockage discovered on the MRI scan could be a rare and aggressive cancer, cholangiocarcinoma. Dr. Google, who I immediately consulted post-GP call, gave me a likely survival rate post-diagnosis of 4 to 6 months. I felt sick. Despite his earlier misgivings about discussing the matter over the phone, my GP proceeded to calmly advise me that the liver blockage discovered on the MRI scan could be a rare and aggressive cancer. Oh, sorry, I've already read that, apologies. Up to that point in time, nothing in time had ever prepared me for being just as helpless as I became. It did not sit well with me. It will come as no surprise to those who know me to learn that despite the awfulness of the prognosis, the severity of the surgery, which may or may not be possible, and the significant practical difficulties faced by falling under 2 different health services, these were all dealt with as obstacles I needed to overcome, not ones to be overawed by. For me, becoming an immediate member of the biggest club no one ever wishes to join was a difficult and humbling experience. No longer was I captain of my own ship, choosing when, where and with whom I sailed, but a deckhand whose destiny and entire survival lay in the hands of others who I'd never met. As a patient living on the Welsh side of Chester, my journey was made significantly more complicated by the fact that our local hospital didn't fully diagnose or treat cholangiocarcinoma patients. As a consequence, I was referred to Liverpool University Tertiary Unit, and what was an already incredibly stressful situation became further prolonged by scans being performed by NHS Wales, advice and instructions coming from NHS England, and thereafter often back to NHS Wales again. Psychologically, this was very hard. It was then, in my darkest hour, feeling wretched and helpless, that I reached out to AMMF for guidance to ask if they could recommend an expert to help me. A constant I could contact who I could be confident actually knew what cholangiocarcinoma was and could provide me with clarity and information regarding both my prognosis and treatment options. I will never forget my first call with Professor Bridgewater, nor the powerful and honest words he uttered. "It is a difficult cancer to manage, Pamela, but it is our intention to cure you." It was the first time in 3 months I felt hope. Professor Bridgewater inquired which tertiary unit I was under. I informed him Liverpool University. Professor Bridgewater spoke very highly of the skill and competence of their resident hepatobiliary surgeon, the wonderfully gifted and incredibly humble Mr. Hassan Malik. This confidence gave me great comfort. For anyone who is blessed to be under the care of Mr. Malik, they will know that a nicer, more genuine person you couldn't hope to meet. Someone who, despite his own vast skill and knowledge, is always keen to reinforce the important contribution his team makes to ensure their input is also recognised. But in my experience, what really drives the human soul on when things are tougher than you could possibly ever imagine is hope and trust. Hope that tomorrow your pain will not be so great, that you will be able to walk a few more steps than you could today, and that, if lucky, your life will return to some sort of normality. And trust in the skill of the wonderfully gifted surgeon and his team who will, if you're fortunate enough even to be eligible for surgery, quite literally take your life in their hands and buy you many more days than you ever would have had. My journey post-surgery was much, much harder than I could ever have anticipated. Post-operative delirium, where I lurched between partying with Donald Trump and calling my loved ones at unearthly hours to urge them in whispered tones to come and get me, I'd been abducted. Post-operative ileus, unbelievable intolerance of everything, a liver abscess, sepsis, and 6 whole weeks of the foulest antibiotics you could ever possibly imagine that, despite my churlishness, Mr. Malik refused to let me stop taking in order to make sure my abscess healed just in time for me to go on a clinical trial. And these are just some of the delights I experienced. Eventually, though, through the haze and constant pain, the sun started to shine again, the downward spiral I had been on for many months began to reverse, and I started to heal. And in times of quiet contemplation, I often asked myself the million-dollar question: was I unlucky or lucky? Was I unlucky to develop a rare and aggressive cancer with a poor prognosis that very few people knew about and I couldn't even pronounce? Or lucky to have crossed paths with a vigilant nurse practitioner who sent me for an ultrasound out of an abundance of caution? AMMF, who guided me towards the extremely knowledgeable and kind Professor Bridgewater, who gave me my first glimmer of hope. The incredibly gifted Mr. Malik and his team for getting me safely through 10+ hours of complex surgery to remove a 1.6 centimetre tumour that, had it not been discovered early enough, would likely be well on its insidious way to kill me by now. And finally, the wonderfully kind, caring and positive trial team at Christie's Hospital, Manchester, who I always feel genuinely care about and are invested in my health, well-being and success. And I'm very conscious standing here that one thing stopping me from telling a very different story is timing and vigilance on a single ordinary day by a single nurse practitioner. On this basis, I have decided I am lucky, and whilst I seek to celebrate this outcome as best I can, it is not lost on me that I'm still in Sniper's Alley and my journey is far from over. 17 months post-surgery is much too early to declare victory, but I'm grateful for the extra time I have been given, and I'm here to tell my story for the many people afflicted with this disease who weren't as lucky as me. And I remain hopeful that the amazing medical advances made by many of the people in this room will continue to give me and others the one thing I had quietly assumed I would always have. Time to be present for those I love. Time to make the plans we all spend our lives working diligently for in the quiet assumption we'll be there to enjoy them. And if there is one message I'd hope to convey here today, it is this: early detection saved my life. And part of that, in my case, was the quiet, unglamorous, life-saving power of looking again. As for the dull, intermittent pain that sent me to the doctors in the first place, to this day it remains without any clinical explanation, disappearing just as spontaneously as it appeared. Finally, although there are deep psychological and physiological scars that will remain with me forever, the words I choose to live by were those uttered by Mr. Malik 3 months post-surgery, when he confirmed that my liver abscess had healed, there was no evidence of disease, and that I must now go out and live my best life. Thank you for listening.